So, I mean, this is something that's different. I mean, typically for low-profile systems, you have purely an aspiration catheter, which doesn't tend to work as well on organized thrombus. Now you've got a device that you can use to take out organized thrombus that's at a low profile. Does that change the treatment paradigm for you, like you were talking about?
100%. When we do these cases, I mean, we have so many different choices available to us today, and I think that's great. I think that's wonderful to have the options. The issue is we have to understand, I just showed you many cases, 2 cases that demonstrated that even in acute phases of this spectrum, we have different morphologies of thrombus. And the fact that the Pounce has the basket, we can actually core out some of that, chronic thrombus, and then all of that can be then utilizing the mechanisms of the maceration and the extraction. You're able to bring that into the catheter itself. So we have dual mechanisms, multiple mechanisms, and I think when I look at venous thrombus type cases, I have to be prepared for treating the full spectrum, and not all devices can say that they can do that, and I think this clearly has that benefit going for it.
With this device, traditionally with mechanical venous thrombectomy, we oftentimes will get pain in that compression spot or in that common femoral spot, or we kind of have a fixed device so we can overstretch the vein. Do you think being able to size to the area that you're treating is of benefit?
Oh, definitely. I mean, especially with the chronic cases, sometimes when you pull back and you see the back is, start closing, you can tell you have some resistance. You can easily close the back, pull it back, and deploy it again just below that. So there's a significant improvement there. So you're not having to kind of really try to aggressively pull and yank on that. So I don't know if that's the medical terminology, but to try to pull that chronic clot, and that's where the patient have a lot of pain. So there's a lot of unique dynamic for this device that's very helpful.
So in my experience, like some of the other presenters have mentioned, it's excellent. I found that the device is excellent for both acute and chronic thrombus. It allows for thrombectomy using just a 10 French sheath, which I think is an important consideration in smaller patients. And it's a great option for removing thrombus in the upper extremities.